Thank you very much, Balozi Togolani. His Excellency Othman Masood, First Vice President, Revolutionary Government of Zanzibar, Mama Anam Kapa, Honorable Masood Nasor Ahmed Mazrui, Minister of Health Zanzibar, Permanent Secretaries, Samahani, Ministers present, and Deputy Ministers present here, Permanent Secretaries, Member of Diplomatic Corps, representative from business, community, and non-state actors, distinguished participants, ladies and gentlemen, habari za asubuhi. It is my great honor and distinct privilege to provide a keynote speech on commemoration of the great statesman, former President of the United Republic of Tanzania, the late Benjamin William Mkapa. Everyone here understands Mkapa indefatigable work and reputation as an economic reformer, and his work on giving wider space in the private sector and privatization of public institutions which were malfunctioning and those which had already collapsed. Additionally, among many achievements in fighting poverty, President Mkapa introduced a system of dialogue between the government and the private sector to support his vision on socio-economic development. Ladies and gentlemen, Mr. Mkapa leaves behind a stellar legacy. He was a consummate politician and a leader who understood the power of private sector and knew that his country would need the support of private sector and the international community as it sought to build an inclusive economy with better services for all Tanzanians. In that regard, the theme on this panel on innovative public-private partnership approaches towards attaining universal health coverage, and the other one on accelerating strategic health transformation in Tanzania through Business Coalition for Health, align with the philosophy and desire of the late President Mkapa. Distinguished participants, after leaving the public service, Mkapa, ambitious for universal health coverage, led the establishment of the Mkapa Foundation that so far has reached millions of Tanzanians, focusing on improving rural health services, health and well-being of women, men, and children, including the one living with and affected by HIV and AIDS, pregnant mothers, and many others. We are all here to reflect this remarkable achievement. And Dr. Ellen Mkonda has outlined a number of achievements which has been foreseen during President Mkapa's service after his retirement from public work. Ladies and gentlemen, as you are all aware, governments across the world are very keen on using public-private partnership to deliver infrastructure and services in order to find more ways to meet the huge demand for financing and delivery of quality services. I understand we have panelists here who will discuss in details Tanzania's efforts and approaches towards PPP, Business Coalition for Health, and private sector participation to accelerate quality health services for all Tanzanians. Specifically on panel one session, we have Ministry of Health Permanent Secretary or his representative, who I believe will share Tanzania's enabling environment to attract private investment development through a solid legal and regulatory framework, establishment of a dedicated PP unit, and creation of a mechanism for the government to provide financial assistance to PPP projects. Additionally, I believe Dr. Ali Nyaga from the Ministry of Health Zanzibar will share the same perspective on the Zanzibar side, and Madam Hudan Adu from UNFPA, from UN Women, will highlight a UN perspective towards achieving universal health coverage. I'm also delighted that Dr. Ogilo from Association of Private Health Providers in Tanzania is here and will share private sector perspective in this regard. I'm also delighted that on panel 2, my counterpart, Honorable Nasor Ahmed Mazrui, Minister of Health Zanzibar, will share insights on Business Coalition for Health as a strategic approach for accelerating access and quality of health services. I do also recognize the presence of Prite Arora, who will share World Bank perspective on private sector involvement, and Human Capital Development Initiative, together with Ms. Mwamvita Makamba. And Chief Executive Officer of Aga Khan Health Services Tanzania, Mr. Sisao Conti, will share with us a journey towards a successful hospital business model in Tanzania. Distinguished participants, ladies and gentlemen, while public-private partnerships are gaining a solid foothold, it is also true that there are a lot of impediments and challenges. Although each country has its specific context and issues, we believe that 4 key areas will make them even more effective. 1, comprehensive policy, legal, and institutional frameworks that provide clear guidance and procedure for development and implementation of PPPs. 2, good coordination among government agencies is key to attract private investors on effective delivery of healthcare services. Realistic and comprehensive technical, socioeconomic, and commercial feasibility analysis, which leads to PP investment in poor and underserved communities at all levels. Engage private sector in health project finance, a model that has shown success in many countries all over the world. Ladies and gentlemen, I believe these 2 panel sessions will inform and expedite the development of health sector-specific guidelines and framework for managing implementation of PPP in Tanzania, a mechanism for realizing universal health coverage. In closing, I would like once again to thank the Mkapa Foundation for their work in arranging this symposium. I'm sure it will be a very good opportunity to share the latest knowledge, experience, and best practices of PPPs. I would like to wish you all a very productive time here in Zanzibar. I look forward to meeting many of you and sharing in fruitful discussions that will help us to further promote public-private partnership, because universal health coverage is an attainable and much-needed goal, and the time to achieve it is now. May Mkapa's spirit of saving life within us forever. Thank you very much for listening.